Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Welcome to the Feel Better, Feel Great podcast, episode 124, Improving Organ Performance. This is a series on how to look at the different organs, and this one is medicine for the brain. I'm Dr. Andrea McSwain. As we delve into the podcast, I want to remind you that while I am a medical professional, the information shared here is intended for educational purposes only. It is not a substitute for personalized medical advice. Please consult with your healthcare provider for guidance on your specific health needs. Let's talk about the brain. So I think the brain's interesting for many reasons. Obviously, I call it the master control center, as it's imperative for your functioning of your electrical system throughout your entire body. And it's your emotional center and your cognition center as well. And it's interesting because this is the only organ that has two different types of doctors, neurologists and psychiatrists. And you could argue neurosurgeons. I think they warrant some credit. But I have seen the importance of brain health as an electrical system and as the master control center in my practice. I've seen when it has problems and the consequences. And while there are many of those, I would like to explain one that's very brief. I have a patient in my practice, a 77-year-old female, who was doing great. She's at home, living life, no problems, but she hit her head on a metal shelf in the garage. And this acute injury led to some irritation in her brain. Now, she did not have any CT findings that were abnormal, but she did experience vision changes with blurriness. Blood pressure started going cattywampus and being very inconsistent, and it really impacted her cognition and ability to process information, but also it affected her way to process emotions. We were able to use some supplementation like high-dose B12, some cranial manipulation in the practice, and things worked out pretty well. I also have another important example of a 45-year-old female who was having a lot of brain fog. And we were working on it, making some headway, getting the body working again. So she was losing weight and metabolically feeling stronger. Her brain was clearing up and she didn't feel as sluggish anymore. She was taking her son to high school, and in the left lane, she got hit from behind. Now, this minor case of whiplash led her into entire shutdown of what was going on in her body and her mind. And she almost had to consider taking FMLA because she could not work. And so you see how much the brain center can actually have a lot of consequences, even in sometimes small situations. Now, I would argue that in those cases, there were some things stacking the deck against them, particularly the patient with the whiplash situation, because that should have not been so severe. I say should have, but recognizing that there were other implications that really made that a very difficult circumstance. Okay, so by convention, how do we address neurologic problems? Well, first of all, we have to identify what are neurologic problems. That's a very important consideration because when we're talking about the brain, right, we're looking at cognition, emotions, and as well the electrical master control. So you can see any number of symptoms. When we first look to cranial nerves, there are 12 nerves that come right off of the brain that work quite often in the face and around the ears, right, in the throat. And then we have the cranial nerve 10, which is the vagus nerve, and that extends very far down into the body. We'll talk more about that in a minute. And then the other issue is looking at the spinal cord and then all the offshoots of the spinal cord down to the sacrum. So that is the, again, electrical system for the body, and the brain is the master control. So sometimes there can be effects when the brain has a problem, and we see that all the way down in how the peripheral nervous system is responding. Additionally, there are ways to test your thinking ability, so your cognition, and then emotion is a lot more difficult, but cognitive testing looks at the frontal brain. And I want to talk today about how emotions affect cognition, but we'll talk about that later. So the simple 23-point cognition test, it's a mini mental exam, MME. It can be done quite easily, and it usually asks about word recall and counting backwards from 7, and then it asks you to draw something. So, most people can function with that very well. A lot of times that doesn't show much decline until it's really compromised in our cognition. So that test isn't much. And the mini mental exam is, like I said, really more for someone who's severely having cognition issues. If you're noticing brain fog, though, you might be noticing some more subjective word loss. Like you might be noticing some small changes that other people don't notice. I'm going to get into that a little bit later as well. So back to testing by convention, we have imaging tests, right? We're looking at the electrical system and structures with magnetic resonance imaging or MRI, and also CT scans. You can also see with PET scans some information, and then there's also EEGs, which look at the electrical system in the brain. Pharmacologic treatments for the brain are quite vast, again, because we're looking at things that the neurological disorders related to depression, anxiety, seizures, psychiatric disorders, and there are many different medications there. Sometimes these medications are actually applied in some ways that can be quite controversial. And a lot of times, too, they create some zombie effects for the person. So the person doesn't have problems, but actually the person still has things that need to be worked through. They still have medical conditions. They might still have psychiatric conditions or mental health situations that need to be addressed, but oftentimes are given these antidepressants and even antipsychotics, which I have seen antipsychotics used to help grandma sleep because they are highly sedating. Since I do not like the use of atypical antipsychotics for sleep problems, because that seems very, very excessive. There are some memory support. We'll talk a little bit about that today with some anti-dementia meds, Alzheimer's meds as they're called. There's really little evidence there's a lot of evidence actually that they don't work, but the idea a pill for an ill is a great way to give something to someone who is at least doing something, as some people say. Well, at least I did this. Doing something isn't necessarily creating an effective improvement. There is a new anti-dementia med on the market. It is a monoclonal antibody, which is an immune modulator that targets plaque in the brain. I think that is very interesting. I'll talk a little bit about that, but I will say it's interesting to use an immune modulator that targets neuroplaques when it's also possible to do that by looking at treating it with vitamin B6 and other B vitamins. And then looking at surgical interventions, deep brain stimulation or epilepsy surgery, which is usually a removal of a portion of the brain. We had a patient in our practice who had dysphagia, actually aphasia, that was increasing. And when she did go to a large medical institution, they did recommend a resection of a portion of her brain that could have indicated some pretty significant permanent consequences to the use of her hand and also memory, as she recalled to me. I have seen deep brain stimulation as a possibility for sleep apnea by activating the cranial nerve 11. And by doing so, you actually will get the small muscles around the trachea to stay a little bit active so that they'll keep the trachea open. Another way you can do that, actually, just kind of a sidebar, is keeping your tongue relaxed and letting it fall instead of keeping it hyperactivated. As the tongue releases, the brain will be stimulated to keep the muscles around the trachea open. So that was definitely a tangent regarding conventional surgical interventions, but I wanted to take the opportunity to give some a case study of a situation of a patient whom I know, and then also look at how we can possibly avoid surgery and use other mechanisms of activation within the body so that you know them. So then what is holistic medical evaluation and treatment for the brain? Obviously looking at patient history, lifestyle, diet, stress levels, which really are more about functional capacity issues. Again, you look at subjective and objective here because the subjectivity of cognition is very important to reduce the progressive nature of memory loss. The other thing I look at is what I call the loop length. When someone is starting to get into a set pattern of what to say, and they have that oftentimes with people that they know or situations that are the same, so they're looping. And that sometimes takes a lot of effort at first when you're maybe listening to someone or when I'm listening to someone, and I start to realize that the conversation is the same every time I hear them talk or we have a conversation. So then I put that kind of in the hour loop or the 45-minute loop. And then it becomes much more obvious when people start getting into the 15-minute loop. So their background or their cognition is limited to a 15-minute span. And they'll just inherently recycle the messaging that they've already said again. And then you start to narrow that into 10 minutes, 5 minutes, 1 minute. And then you'll find, as my friend's grandmother did with significant dementia, is sitting at the restaurant table wondering where we were. Where are we? Where are we? And you start to just get the same question over and over. And that's in very significant dementia. But I'd like if people could start recognizing when the loop starts and it's much longer so that it's something that has more subjectivity and also hopefully can be treated much sooner. So who can help appreciate the brain as an organ that can develop dis-ease? And I would give a tremendous amount of respect and honor to many practitioners, but two I will highlight right now. One is Dr. Dale Bredesen. He has written a book in 2013 or 14 called The End of Alzheimer's. And it's hard to believe it's been 10 years. But within that, he showed that monotherapy is ineffective for Alzheimer's or dementia. You could expand on that. He uses a cognoscopy. So he wants to recognize the number of holes that are in the ceiling. And I think that this work, this body of work deserves high reverence because he's going against the system that is saying a pill for an ill for situations like Alzheimer's. And he's giving credit to the integrity of the brain to be able to withstand many problems: infection, inflammation, stress, nutrition deficiencies, toxic plaque accumulation. And as a result, it's still able to function quite well until you start getting multiple holes and very extreme difficulties for the brain. Another person is Dr. Daniel Amen's work, and I think that they have brought so much to the attention of the public with the support of the brain to reverse disease. So that is wonderful. Dr. Amen has several works. And then we go into some nutrition therapies for holistic medicine evaluation treatment. So clearly there's some very important nutrients that the brain really, really loves. Omega-3s are paramount. Pregnant women take DHA to support the baby's neurologic brain development. That is critical. As I mentioned, vitamins B6 and 12 are very important for the brain. Magnesium is wonderful. And then there's something called heparzine, and we have that in Memory Forte. So heparzine is one of those fantastic herbal supports that gives so much support to the memory and can help quite a bit in cognition, as does ginkgo biloba and turmeric. Looking at another method of support is looking at some biofeedback messaging and neurofeedback. So when we look at those, we recognize that if you get into fear patterning, then you will find it difficult to have cognition. So the fear center is part of the brain. It's part of the primal brain. It's part of the central brain. It is very important for us to have. The amygdala is among them, one of the structures. And when we have fear, cognition will shut down, I should say, or shut off, because fear is about survival. And many times, dis-ease in the body and throughout the body is related to the activation of the fear-based brain, because it is shutting down cognition, it is shutting down objectivity, it is setting patterns in place for survival, which is of the utmost importance. Meaning that when we look at things like nutrition therapies and they're not improving cognition or brain functioning, especially things like heparzine, then we need to look at the adrenals. I was recently speaking to a friend who was having problems getting his boat to work, and he had his whole family on board. The boat stopped in the middle of the lake. Not a big lake, not a particularly big deal, except their young child had just had an injury on the boat. Again, not a particularly significant injury, but they couldn't go anywhere to handle this situation. And so my friend later recalled how much this fear blinded them, even with their very good mechanical capabilities of that they knew how to get the boat running again. But by calling a loved one and walking through the process, they were able to get the boat going. They were listening to someone they trusted and loved, and then they were able to get to land and then get the support they needed. The issue here is that a very competent person can be easily blocked with fear. So cognition is blocked by fear. And that is very important, because when we start to look at mind-body practices like mindfulness, which is basically mindfulness. Mindfulness techniques, I think, are often thrown at people to like, you should meditate, you should do yoga, you should do Tai Chi. But if you're sitting there distracted by all the fears that you have, then it's not going to work. So mindfulness can happen, and I encourage people to have mindfulness in very simplistic way by, feeling their feet on the ground and looking at how much the temperature is as it relates to their skin. So they can feel their skin. They can turn off their eyes and the eyes' visual occupation in the brain. So the brain very much has a strong visual occupation. And so when we shut off our visual senses and just let our eyes gaze and not gather information, we start to be able to feel touch, smell, sense, temperature, air, the ground, all those things, all those feelings start coming in as sensory information. And so mindfulness can happen by adding more objective data. And that's something to carry on throughout the whole day. That's the other issue that people have with meditation, again, is that they're often told to shut down the brain. And I think that's a control mechanism. I think it's very important to realize that things need to flow through us. And so if things come in, let's say, for example, should I have eaten that hamburger last night? Let's just say that. Then it goes out. Well, that's not something I need to consider right now. That's something to let go. And so it's like, okay. So mindfulness is one aspect. Meditation is an opportunity to learn to flow with things and not have control by saying, I shouldn't be thinking, or what people do. And the other thing is, if you're in the moment with yoga and Tai Chi, but you're not actually there, that's possibly just going to lend to injury, because mindfulness is about being in the physicality, and the physicality is about then allowing your brain to connect to your muscles, because your muscles are organized and facilitated and recruited by your brain and your neurologic system. So neuromuscular programming means, how do you fire what you fire? And I find often in my practice, when people are nervous, what do? They clench their jaw, or they move their lips, and they start getting into this mastication of the moment. And so that's very fear-based. And now they have a neuromuscular patterning to their jaw and the grinding, which then carries on as well while they're sleeping. And then the sequelae of having jaw grinding with the teeth and the jaw and the ears and the neck and the head, and etc. So when we look at neuromuscular programming as a holistic approach, I mean, it's really, to me, founded in science, neuromuscular programming, neuromuscular medicine, osteopathic manipulation, osteopathic manipulation methods or techniques. These are all very similar ideas, but my favorite is actually neuromuscular medicine, because neuromuscular medicine says it all: the nerves and the muscles, and there's the science. It's a basic anatomic and physiologic ability to understand in the term that you're actually using your brain and your nerves to tell your muscles what to do. And when you do that, you stay in the cognitive brain. And that is very important, because when you stay in the cognitive brain with your muscles, then your body is staying out of the fear brain. So I really love neuromuscular programming. A lot of times in my practice, I use it faithfully and very dedicated as a practitioner. And then I find sometimes people ask me, well, what exercises should I do? And I try to help them realize that it's the neuromuscular programming. So to reorganize your neuromuscular system, you really want to move in a way that doesn't have to be introducing a lot of stress necessarily. It just has to be introducing organization. And so by telling the brain, and then the brain telling the body what to do and how to fire, you start getting into organized patterns and creating efficiency in the body. And that is very important, because now the brain is using the cognitive aspects, therefore it is minimizing the fear-based aspects, and it's transmitting that information then throughout the entire body. And there's a tremendous amount of health and well-being when the muscles get engaged in an organized pattern from the brain. So it's a very important loop. Now, a lot of times people will tie in that emotional loop as well. And I think that is really great when we can look at the physicality of our actions to actually enhance our cognitive functioning. I will talk a lot more about that because it's something I'm very passionate about. I do want to transition, though, into some ways to understand the gut health, gut-brain axis, and then move into another part about some practical tips. Okay, so when we look at the gut-brain axis, okay, so not to make light of it, but I feel like a lot of people are calling like gut-brain axis, like da-da-da-da-da, like basically just trying to put in your mind that things are connected. So the gut is definitely connected to the brain. I mean, the expression of go with your gut, go with makes sense in your body, right? We know the immune system is integral in our gut. We know that the programming for the immune system is in our brain as well. There's a lot of organization that happens when all these organs connect. So the vagus nerve, which is getting a lot of attention, is coming from the brain directly. It's called the wanderer. It goes down, it gets into the gut, it goes past the heart. And so there's actually like an actual electrical cord from the brain connecting all these pieces. And so when people think about the vagus nerve, they're often thinking about calming, or the absence of calm. And I can appreciate that. I do agree that the vagus nerve is very vital. I think sometimes what people don't put together is that the vagus nerves comes out near the spinal cord exit. And when it does that, if there's a little bit of an angle there, you get a lot of influx into alterations of the vagus nerve information. So a lot of times people are talking about it down here, but it has a lot of functionality. And I think it's important for us to recognize that. So that's how movement helps us work the vagus nerve. The other thing is mental health. So one of the things that's important is looking at people who get hangry, who have blood sugar hypoglycemia, which means low blood sugar hypoglycemia, and they get hangry. If you're someone that gets hangry, you're starting to spike and trough with your blood sugar. That is very, very disruptive to cognition. And while I agree with principles of fasting and I agree with a lot of things, if you're hangry, you're going into a primal response, and that's starting to get programmed in your brain. So sometimes fasting or actually just using your brain will contribute to low blood sugar because the brain uses a lot of glucose or blood sugar. I use those terms interchangeably. And so it's really important to be aware of that and recognize that you want to get quality, simple carbohydrates and also sustain your blood sugar. It's one of those vital signs that we can tell in your blood work, or we can tell in your emotions. It's not technically a vital sign as a physical exam. But if you're getting hangry, it needs to stop. The other thing is when you are troughing and then spiking with blood sugar by using things like simple sugars in different foods, you might be feeding the candida or the mold, and this will be impacting cognition, hormone expression, and that can be quite detrimental to your emotional well-being. Next, looking at keto diet and its kind of landmark impact on schizophrenia and also bipolar, I think. Because in the late 1800s, they were talking about the use of a keto diet for people with schizophrenia. I have met several people with schizophrenia who have regulated their schizophrenia with the use of a ketogenic diet. And so how our brain processes sugar is very important, particularly if there are some mental health diagnosis or mental health concerns in areas of schizophrenia and bipolar. So that's an important conversation. It's often ignored, unfortunately. But if you're dealing with those severe conditions, then it is very important to address diet because that is going to help you create more of a steady state of your emotions and cognition. And obviously stress in the gut, the brain and the gut have a lot to do with each other in this area. If you're in a high stress state, your gut isn't going to necessarily be working, so you're not going to really be processing food. I talk about this in another podcast, probably episode 104 on gut tube health, that we really have to minimize what we're eating when there's a high stress state because it can impact our ability to process food and nutrients. So those are some things. And then the other thing I want to say is we go into practical tips. So it's kind of an extension of gut health because with the gut, we eat every day and then that impacts our well-being. But I would like to say first and foremost, finding joy. So when we look at the gut and the brain, we look at some neurotransmitters that either come from food, right? And there's a lot of medications that are synthetic versions of this that help us find joy. When we have joy, laughter, love, we often stay in our thinking brain. And joy can come from some neurotransmitters like serotonin and dopamine. And there are serotonin and dopamine rich foods. There's also ways to support serotonin with tryptophan and B6 and support dopamine with different supplementation so that you can help you find joy. The other one is make sure that sleep. So sleep is very important for us to rest. as you know, but making sure you get the TV off, you get the lights off, and you get that chance to sleep. This is very important as well if you are smoking, because you want to get that stimulant, or if you're drinking caffeine at night, or anything that's going to aggravate your ability to sleep. So I'm just thinking alcohol towards the evening can also be difficult to get good quality sleep. Of course, there's very good literature on ways to optimize your brain health. Of course, the work of Dr. Bredesen, Dr. Amen. We know omega-3s are critical. There's literature on using omega-3s to treat seizures. Did not make this up. It is all throughout the medical literature. If someone you know or love has a seizure, then it is paramount for them to use omega-3s, because they might be wildly deficient in them. And please look up the literature on that. It's very strong. I have seen many people recover from seizure activity by supplementing with omega-3s, particularly DHA. And then, of course, avoiding those foods, as I mentioned, that are simple sugars, or even looking at those beverages that people use that are simple sugars that are replacing water. I mean, that's really important, because blood sugar dysregulation can happen with a lot of different beverages, and they can have a significant impact on the brain. And then I'd also like to say that in seeking professional advice, the main recommendation that I would have is Dr. Ray Petrus through our clinic. He offers telehealth visits throughout the country. When Dr. Ray Petrus works with someone, what I find is he is able to, first of all, recognize that the mind matters. And second of all, he's able to help people access the subconscious mind and actually release from the subconscious mind these programmed thoughts and patterns. And while it seems incredibly innocuous working with Dr. Petrus, it's over the phone, it's very relaxed, he has an incredibly calming voice, and the impact is monumental for a place of well-being and resolution in ways that you may never have thought possible. And when we heal the brain cognitively, emotionally, we start really seeing the master control and the capacity for it to organize and maintain a sense of well-being throughout the whole body as a significant shift. So I want to thank you for today. I hope you read the show notes. I hope you reference these wonderful providers who have done so much to really change the way that we can help ourselves with our brain health. Thank you again.